Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for today's COVID briefing. Joining us today, the Honourable Tim Houston, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Good afternoon, everyone. First off the top, condolences to 8 families who have lost loved ones since our last COVID briefing, so condolences to the families. Today we're going to talk about hospitalizations, schools, and an update on boosters. So first let's start with hospitalizations, but I want to talk a little bit off the top too about the impacts of COVID. COVID has really 2 impacts on our lives. The first impact, and the one that we often talk about here at these briefings, is the ability to work and enjoy life, and the second impact is obviously the service delivery, the impact on the health authorities. So there are many factors that impact both of these: vaccination status, pre-existing conditions, the human resources in the healthcare system, the preparedness before the pandemic are all just some of the factors. So it's important to stress this because where we can each do our part to reduce the burden on the system, we should do it. So here's where we are today. There are 83 Nova Scotians in hospital today with admissions related to COVID. So to me, this number is an indicator of the direct impact this variant is having on people's lives. It's the first impact I've talked about, the ability to work and enjoy life. Of this group, 12 are in the ICU. The average age is 68. Of those in hospital in this group, 20.5% have no vaccination. There are no children in the hospital. The average length of stay of a COVID patient in a Nova Scotia hospital right now is 6.5 days. So for these briefings, we've tended to focus on those 83 people, those 83 Nova Scotians who are admitted because of COVID in the context of discussing the severity of the virus. These are the people whose COVID was so severe they could no longer manage their symptoms at home. But at the same time, I agree that if you are in the hospital and you have COVID, more resources are needed. More resources have to be diverted from regular services to provide care. So it is appropriate that we look at this number. And in terms of that number, there's a total of 256 Nova Scotians in the hospital today with COVID impacting the system. This includes the 83 that I've mentioned, but it also includes 66 patients in the hospital who were admitted for other issues, but were discovered to have COVID on arrival at the hospital. So this could be a heart attack patient who on admission was found to have COVID. And there are further 107 patients who were already admitted for other reasons and have contracted the virus in hospital. So an example of this would be a patient who's in for a hip replacement but contracted COVID while recovering from their surgery. So with 256 total Nova Scotians in the hospital, you can see where the pressure is mounting on our healthcare system. So I want to say clearly to our healthcare workers, I know the burden you're carrying. You're overworked, overwhelmed. And there's a lot of emotions, and I share them, and I certainly don't blame you. We're all feeling a bit overwhelmed right now. This is a lot for anyone, and you're on the front line. So we hear you, and we see you. We were also overwhelmed in a positive way, and that's those who came forward to help with boosters. So we're now at the point where we have more volunteers than shifts. So we put the cry out for volunteers, and people stepped up. So thank you for that. This is incredible. In such a short amount of time that we've had so many volunteers and that have sprung into action. I really appreciate that. I have expressed some frustration this week to the health authority over the fact that some of those who volunteered and offered to help didn't hear back. This was a thing that we really didn't want to happen, and it did happen. So for that, to those Nova Scotians that volunteered and didn't hear or haven't heard yet, I apologize. In a province where our healthcare workers haven't always been respected appropriately, I don't want you to think for a second that we didn't appreciate you putting your name forward and sticking your hand up and saying you would help. So healthcare workers are exhausted. I know you're exhausted. You've given everything you have, and you offered to give more. So from the bottom of my heart, I thank you. Let's talk about schools. Our schools opened on Monday. I know there were some hiccups, but my understanding is they've been worked out. We expected some hiccups on the return to school, but they've been worked out. Classes without updated ventilation systems now have the systems that we were ordered. That's a good thing. All students and staff have been provided with 3-ply masks. That's a good thing. So despite the incredible, well-documented global shortage and issues with rapid test supply, rapid tests are also available in our schools on a need-be basis, and so that is also a good thing. So I thank everyone behind the efforts of making that happen. It's much appreciated, and it's been more smooth than not smooth. I'm very pleased with that, so thank you for that. Just as a point of reference, normal attendance in our schools is around 88 to 90%. These last couple of days, attendance has ranged from 80 to 88%. So simple math suggests that there are about 8% of families who kept their children home for one reason or another. And I certainly respect that. The emotions of the situation are not lost on any of us. They're certainly not lost on me, and I feel them. So I want to stress, though, that our schools are safe, and our schools are as safe as our communities. So anything that you can do to help keep our community safe, it helps keep our schools safe. This is why Dr. Strang and I are limiting our personal contacts and appearing virtually for this. The reality of schools being open is not contradicting the message that we need to reduce activity and work from home in our communities where possible. These are not mutually exclusive directions. They're exactly consistent directions. When we keep our communities safe, we do our part, and we do our part to limit movement. We in turn protect our essential workers. Right now, those include healthcare workers and, of course, our educators and people working in long-term care across the system. So when we protect our essential workers, we protect our children, and we protect the access of our children to the education system. So we're not oblivious to the stark reality that many of our jobs require us to work outside the home. We know that. So let me assure you that I fully appreciate this. But to those that can, limit your movements where you can. Where you can. So we can all do that to help keep our schools open. So another measure that we can take to keep our students and staff safe is vaccinations. Before I speak to vaccinations and boosters, I'd like to touch quickly on contact tracing, though. Apparently, there's still confusion around contact tracing. So to be very clear, nobody is restricted from telling anyone that they have COVID. If you have COVID, you can tell whoever you want that you have COVID. That's absolutely, of course, the case. People can share what they want to share about themselves or about their families in any way they want. But right now, at this stage of the pandemic, the reality of this wave and the reality with COVID right now is we need to, and this is why we talk about personal responsibility. When we talk about personal responsibility, we mean that given all of the COVID around, people should be aware of their own health status, and they shouldn't rely on contact tracing or exposure notifications from the government or from anyone else to manage their own health. This is the time to take responsibility for your own healthcare status as much as you can. This is this time to support one another. That's the Blue Noser way. And we know that our children want to be in school. We know that school staff have done their part to keep school environments safe by getting vaccinated. Now we need parents of children over 5 to do the same thing. Get your children vaccinated. Give them that additional protection and help us protect our communities and our classrooms. Vaccine appointments are available across the province right now, so please sign up. And in terms of boosters, on January 5th, sitting right here, we said, Dr. Strang and I said that the team had worked hard to open up thousands of January appointments. They continue to blow us away, I will tell you. At this stage in the month, their ambitious plan was to do about 139,000 shots. That included time to get up and running. That included time to work out the kinks. But I will say that they have really They wanted to hit stride towards the end of the month, but they've really hit stride already. In fact, so far this month, they've done in the range of 152,000 boosters. So they're exceeding their own ambitious targets. In fact, they're knocking it out of the park since then. I can't thank them enough. Just yesterday, they did 15,368 boosters just yesterday. So spots continue to open because people are working hard and stepping up to make sure that they open. I do want to say there was a clip on the news last week, and I included interviews with 2 retired nurses that have sprung into action. I was able to track both of them down and speak to them. I want to thank you, Janet, for making that happen. But one of them made a very powerful statement that really impacted me in that news clip. She said that when that needle goes in, she instantly knows that she helped that person. And it was such a powerful thing. And if you stop and think about that, there are thousands of people across this province stepping up every single day to support you and instantly help you protect yourself. All we need you to do is sit in the chair and let them. So please do that. On Monday, we opened up boosters to everyone 18 and over who've had their second dose at least 6 months ago. That's the NACI recommendation. As of yesterday, 82% of our Pfizer appointments are booked up, so people are stepping up and booking them, and we should see more booking up in the coming days. But to date, 50% of the population 18 and over has either had their booster or is booked for their appointment. That is very significant. So thank you for doing your part to keep us all safe. Dr. Strang?
Thank you, Premier, and good afternoon, everybody. And before I start, I want to thank a special person, Professor Jerry Aucoin, for today's tie that I'm privileged to be wearing that he sent me. Thank you, Jerry. And it saddens me to have to start today by acknowledging that 8 more Nova Scotians have died from COVID in the last week. And my deep sympathies go to their families and loved ones. We've had 15 deaths since the Omicron wave started on December 8th. And those Nova Scotians have left behind many more friends, families, and loved ones. For most people, the Omicron variant results in symptoms that are less severe than other COVID variants, but it is much more infectious, and it is still taking lives and leaving many others very sick at home and in hospital. Our healthcare system continues to be under tremendous pressure. Our hospitals are full. In fact, they're beyond the 100% capacity. I've talked with them over the last few days, and it is an extremely delicate balance. Most non-COVID programs and services have had to be reduced so that COVID care can be provided, and also to maintain emergency and urgent care for other health issues. Staff in the healthcare system are under great strain, and they deserve everyone's support and deep gratitude and thanks. And we have a responsibility to help them, and the best way to help is to reduce the circulation of virus in the province. We all need to slow down our lives and be extra careful. As the Premier said, our vaccination rate is very good. 83% of our population has 2 doses, and almost 93% have had a first dose or have one booked within the next 30 days. And about 50% of those eligible to have a booster have had one or have an appointment booked. But there are still over 70,000 Nova Scotians who are eligible to be vaccinated but are not. Vaccination is protecting all of us from severe illness, and it's limiting the impact on our healthcare system and on Nova Scotians who are at risk for severe outcomes. This is the plain and simple truth. So it's never too late to start your vaccine series and do your part to not only protect yourself, but to help your family, friends, and other Nova Scotians. And also, if you are vaccinated with 2 doses, it's important to get your booster dose to strengthen your protection and also add to the protection of all Nova Scotians. We know that public school students are back in classrooms this week, and post-secondary institutions are returning to in-person learning in the next couple of weeks. In-person learning is critically important for all students. Our young people, our future generations, have endured a lot over the past 2 years, and we need to support them now so they have long-term success. I do understand that there is some anxiety about in-person learning. We've considered the risks and benefits, sought input from experts, and made the decision that the benefits of students and learners being in classrooms with their peers far outweighs any risks. And I want to take some time today to address the top questions that I've been asked and many other of my colleagues have been asked about schools. The questions I'll first address: safety in schools. And I want to start by saying that we can't equate safety with being COVID-free. In school or anywhere in our province, COVID is everywhere. So of course it will be in our schools. We can, however, consider the multiple layers of safety in place at schools, and that these are layers that are not in place at many other places in our community. These include masking, increased support for ventilation, increased access to testing, cohorting, and of course, vaccination. Here's what we do know. There is a lot of COVID-19 in Nova Scotia, and it will be in our schools because it is in our communities. Omicron presents in children as mostly mild illness. The vaccine doesn't prevent all COVID infections, but it does protect against severe disease. And a single dose of vaccine provides some protection, and keeping at least 8 weeks between the first and second dose provides the strongest long-term protection. Public health measures in schools provide additional protection and limit the spread of the virus in those settings. And again, being in class with their friends and peers is best for young people's learning, development, and emotional well-being. So the most important things to focus on to slow the spread of COVID-19 in schools are vaccinating everyone who is eligible, staying home if you have any new respiratory symptoms. New cold or flu symptoms means you need to stay home, and that's critically important. And then following the testing guidelines as required, whether it's for PCR or rapid testing, and closely following all the other public health measures. Next week, we will be providing rapid tests to all students and staff in the public school system, and Regional Centers for Education will work with private schools and the Mi'kmaq Education Authority to distribute tests for them as well. And these tests can be used if a student or staff member has symptoms, and because of the potential for ongoing exposures in school, families and staff will have the option to use these tests up to twice weekly, even if they have no symptoms. And I want to take this opportunity to remind everyone that if you've had a COVID infection in the last 90 days, we don't need you to test. It's not advised at all. It's very unlikely that you have COVID, plus your test may still be positive from your prior infection. However, if you do develop new cold or flu-like symptoms, you have another virus that's within that 90-day period, and you should still stay home until your symptoms have improved. The second question I'm seeing often is about contact tracing. And we're seeing many parent groups attempt contact tracing on their own. And while I appreciate that people want to help and feel the information is important, there really is no additional benefit in school settings to have that contact tracing. Relying on being notified by government or someone else official about being a close contact, whether in schools or elsewhere, it gives people a false sense of security. COVID is all around us right now, and it's possible that we will be exposed anytime we're out and around people. That's why we all need to focus on being cautious and using personal protective measures, as well as closely monitoring our own health, staying home when we develop new cold or flu symptoms. That's how we protect each other. And again, the risks of relying on being notified and then the false assumption that if you're not notified, you're somehow not at risk, just don't work anymore with the widespread of Omicron. I recognize that this is a significant psychological shift, and I understand why it is creating concern and anxiety for some parents and teachers. But the reality is that the advice will be the same whether you've been identified as a classroom close contact of a case or not. It will always come back to follow public health measures to keep yourself and others safe, stay home when you're sick and test as appropriate, and get vaccinated with a full series and booster doses when you're eligible. Parents are asked to follow whatever procedures are in place to report an absence in school. Those procedures have been in place well before COVID. And if they want to notify the teacher or other parents that their child has COVID, they can. If teachers want to, they can notify parents and guardians about their own COVID status. But schools and teachers are not expected to notify families if a parent tells them of a positive case in one of their children. The last question I'm getting a lot is, why are children in school, but we're asking people to work virtually and hold conferences and meetings virtually? And the answer is simple. We are asking everyone who can work virtually to do so, to limit spread and minimize exposure so that children can be in classrooms and our healthcare system can continue to function. We've said throughout the pandemic, our healthcare system and having our learners in-person learning are our top priorities. So it's about making sacrifices and choices to protect the people and systems that we have said are our highest priorities. Before I close on schools, I want to stress how important it is for all of us to support our children and youth as well as teachers by creating a sense of reassurance and calm in our language and actions about returning to school. I'm very concerned about the unnecessary fear and anxiety that is being fostered by some groups. Our children and our teachers need and deserve better. I know it seems like this pandemic will never end, but it will, and COVID-19 will become a more normal part of our lives. Until then, follow the restrictions and personal measures diligently. Get vaccinated. By doing so, you will reduce the opportunity for COVID-19 to spread and will be protecting your vulnerable family, friends, and neighbors. Slow down your life to slow the spread in your community. Our healthcare system, our exhausted and dedicated healthcare workers, our schools, our students, and our teachers need this from you. Tina.
Thank you, Dr. Strang. Just a reminder, we'll take one question and one follow-up from reporters on the line in the allotted time that we have for today's briefing. We'll start with Mike Gorman from CBC. Go ahead, Mike.
Thank you. Dr. Strang, regarding contact tracing, the Health Authority website advises folks that if they test positive, they should reach out to their close contacts and let them know. Why should that be different in a school setting, particularly in elementary schools where most kids either are not vaccinated at all or only have one shot?
Well, what we've learned in when we're doing this contact tracing in November and December, particularly, was that doing that close contact tracing and then the subsequent isolation of people who were identified as classroom contacts was incredibly disruptive to our school system and to families. So we're not going to be isolating people anymore. So essentially it comes back to whether you're identified as a close contact or not, especially in the school setting where the burden on continuing to do this contact, this notification is significant. When the message doesn't change at all. It's as I said in my remarks, the message for everybody is get vaccinated. Follow all the personal protective measures, especially, and if you're sick with new cold and flu-like symptoms, stay home. So that message doesn't change just because somebody has been a close contact. And so to have that substantive burden on schools and public health, when they're both stretched, we need them to be focusing on other aspects of COVID and certainly in schools, their underlying mandate, the important mandate of teaching and learning. We need them to focus on those things that are effective, not things that really don't change any action on the part of families and individuals.
Go ahead, Mike, with your follow-up.
It strikes me that our viral situation here in Nova Scotia is not terribly different from our neighbors in PEI and New Brunswick, and yet the approach being used in those two provinces is different than what we're doing here. Dr. Strang, what are you seeing in our epidemiology that makes you confident about the approach we're using? And Premier, why do you feel comfortable using a less restrictive approach here in Nova Scotia at a time when our hospitals are under just as much strain as what they're seeing in PEI in New Brunswick?
Maybe I'll start first. Certainly, if you look at New Brunswick, they started in a very different position because of decisions they had made. They had a substantive Delta wave in the fall, and their hospitals already had a substantive burden of patients before Omicron hit. We were in a very different situation. And if you look at Prince Edward Island, they are several weeks behind us, and they are just now seeing the surge that we had several weeks ago. And also, they're in a different position. They have much less capacity in their hospitals and ICU beds than we have in Nova Scotia. So every province has a different starting point, has a different circumstances. And what we're looking at, we feel it's lots of pressure, but we feel that that we have the right balance of restrictions to slow down the spread, but also we know that all of the restrictions come with their own sets of harm. So we're very cognizant of not going further than we need to.
And thank you, Michael, and of course, Dr. Strang. And I think you just heard the reason why I'm confident. I'm confident because public health is confident. So in this province, we've done well through the pandemic, through 3 premiers now, because we've respected the advice of public health. We've listened to the experts, and we continue to do that. So I have incredible confidence in Dr. Strang and his team at public health. And I assure you, from my discussions with them, they have the very best interests of Nova Scotians at heart. This is about the safety of Nova Scotians. But as elected officials, as leaders, we should listen to the experts, and that's exactly what we're doing in this province. And I thank Dr. Strang and his team for their incredible dedication to the safety of Nova Scotians.
Next, we'll go to Alicia Drouse from Global. Go ahead, Alicia.
Thank you. Just, I guess, as a bit of a follow-up to that question, is there a threshold for Nova Scotia to maybe be more restrictive or follow, what New Brunswick or PI is doing? Is there a certain amount of hospitalizations, or maybe even if we reach a certain number of healthcare workers off isolating, is there any kind of target?
No, I get asked the question a lot. I have been for the last 2 years. About specific targets? It's not about one target. We're in continual discussions, myself and my colleagues within the Department of Health and Wellness, with our colleagues in the NSH and the IWK, understanding all the different parameters that go into their assessment of their situation, and then also how they're responding to that. So it is really on a daily basis. We look at where we're at, both in the epidemiology and the capacity issues in the healthcare system, and how they are mitigating those pressures. And so far, we're all at the judgment that, things are very tough, very tight, but we feel that that from a restrictions perspective, that we have the right level of restrictions to help slow down the spread. I'm going to take the opportunity of your question to emphasize once again that what we need the most from all Nova Scotians is to very strictly adhere to the level of restrictions we have and all the personal measures that we're asking every Nova Scotian to take. We need to do the best possible job with what we've put in place to give that its maximum impact to protect the healthcare system. To me, that's much more important than tightening up some restrictions, which may actually create more people just kind of giving up and stopping following the personal measures.
Go ahead, Alicia, with your follow-up.
Thank you. And can you talk about if it's believed that Nova Scotia has reached the peak of Omicron, and maybe if or when that happened, and how can we actually know when, if we do hit the peak, if rapid test results for the most part aren't being reported?
So we certainly have, we've said for several weeks, we are no longer in a position where we need to know every case. We have several thousand people being tested every day with PCR tests. That is certainly a very sufficient amount of testing to monitor the progress of the Omicron wave, whether it's going up, plateaued, and then starting to come down. We only will never know for certain where we are after the fact, and we can look back and go, oh, that's when we started to come down. So right now, as I said last week, we are right in the middle of the Omicron wave, and which means we're right at the peak. And how long that's going to go on for, there's a number of factors that go into that. But we continue to watch both our the PCR results for that overall surveillance perspective, as well as our hospitalization data, which, as scary as it looks, has been relatively stable for the last number of days. So that's encouraging signs, but it by no means diminishes the impact it's having right now in our hospitals. So we're right in the middle of things. I think, we expect that it's the next week and in the rest of this week and in the next week, we'll start to get a clearer picture of what is the trend and where we might be on that peak, perhaps starting to come down. But again, we watch things very carefully on a daily basis to get that sense of where we're at. But ultimately, we will only know for sure where we are in the peak in the rearview mirror.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Dr. Strang, can you speak a bit about the impacts of having more than 500 Nova Scotia Health employees currently off work, either because they tested positive or waiting on test results or were exposed to COVID? Like, what impact does that have on an already struggling healthcare system in the province?
It's certainly a major factor because, for every person in hospital, you need a bed and you need staff. And you need not just the direct care staff, but all the supporting staff around them that makes the hospital run, all the laboratory, the diagnostic imaging, cleaning, dietary, everything. So there's no doubt that having those workers off is a significant contributor to the pressures. We've made adjustments in terms of allowing people identified as close contacts to go back to work. Or to school with appropriate protocols, and certainly the healthcare has significant protocols, or what we call return to work protocols. They're also continue to look at what are their necessary occupational health and safety and infection control protocols that would allow people to come back to work. Whether they're recovered from an infection or they're identified as a contact in a safe manner. So we're certainly working to mitigate that as best as possible. It is no doubt it's certainly a major part of the pressures the hospitals are facing right now.
Go ahead, Natasha, with your follow-up.
Thank you. Premier, many businesses, specifically those who work in spas and salons, say they need more help from government because of the restrictions that are currently in place. They can't offer all their services or have to limit how many clients they work with on a daily basis. Are you looking at providing any additional assistance to some of these struggling businesses?
It's a constant discussion. I spoke to the minister about this yesterday, actually, and I think it's important to know that, when we went through this before with different lockdowns and restrictions, there was, every time we look at the supports that are there, and so we've kind of been building on the supports that are there where we can, where it's appropriate. So it's an ongoing discussion, but the restrictions, there's not a single Nova Scotian that the restrictions are easy on. They're hard on everyone, for sure. We know that. We feel that. We respect that. So we'll continue to have the discussion. For the most part, the supports have been like very direct impacts. We understand there are indirect impacts, but as well, we'll continue to have the discussions and see if we can do something. We will.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. This is a question for the Premier. Do we have a sense of how the impact of the cancellation of procedures and surgeries related to the staffing crisis? I talked to a young woman today who had been basically confined to bed for months because her spinal surgery has been canceled twice. What kind of assurances can you give to these people that their health care needs will be met at some point?
Yeah, the impacts are real. The postponements are real, and we know that the status of the system, as it's been deteriorating over a number of years now. A lot of times when you get your appointment, it's long past when it, optimally would have been had. So we know that these are real. I certainly hear from a number of people every day in similar situations, and it's heartbreaking. But we'll get through this wave, and then we're completely focused on catching up and supporting those and getting those procedures done. I don't have a timeline for that. We have to get through this wave first, and then we can really focus on getting people those types of care.
Go ahead, John, with your follow-up.
Thank you. This is for Dr. Strang. The number of lab-confirmed positive cases appears to be on the decline in the last week. We're down in the 400 daily case range, somewhere around there. Do you expect that to continue, or can we expect a spike in cases in the coming weeks? As we heard from the federal public health department this week, what's your sense of where the Omicron wave is going?
So our number of lab confirmed cases and our percent positivity, if you look back prior to the weekend we've just been through, it was relatively stable for about a week. Our lab numbers went down, or the positive tests went down, but also the total number of tests went down over the weekend simply because of the storm. So I wouldn't put too much stock in the reductions over the last few days. Today we saw the volume of tests had gone up, but our number of positives still remained lower than we were seeing, and our percent positivity is down a few percentage points. But that's only one day. As I say, we watch things every day, and my hope is that we see that trend continue for a number of days, and we'd have to see that happen before we could make some firmer conclusions about where we're at. Excuse me. The federal government always makes, statements about from a national level, but we know that we were one of the earlier provinces hit by the Omicron, wave and therefore the spike. And as I referenced earlier with PEI, they're a few weeks behind us, and they're just now getting their surge now. So maybe from a national perspective, we're still on the upswing, but we're one of the provinces who are, fortunately or not, we were ahead of the game somewhat, and so we're in a different position when we look at our epidemiology. And I think we've gone through the major spike, and exactly where we are and how long that high level is going to be maintained is what I'm focusing on right now and trying to analyze.
Next, we'll go to Keith Dusack from the Canadian Press. Go ahead, Keith.
Good afternoon, Dr. Strang. You mentioned that we've had 8 deaths in the last week. It's actually 8 deaths in the last 3 days. I also noticed from last week that the ICU numbers have tripled. They've gone from 5 to 15. So my question to you is about what's your sense of the severity of the disease, and who exactly is getting sick enough that they have to go to the ICU? Is it actually people who are in the hospital for other reasons and, may have had serious surgery and couldn't afford to get some kind of an infection but did? Do we have any sense of how that's breaking down?
So what we're seeing is I've talked with my colleagues nationally as well as my clinical colleagues here in Nova Scotia. We're seeing a shift as the Omicron gets into older age groups. Earlier, we were seeing more classic kind of respiratory illness. Now we're seeing as older people, because of age and often with multiple chronic health conditions, we're seeing more that is an exacerbation of that chronic health, or that cluster of chronic health conditions, an exacerbation of frailty in an elderly person, which is resulting in them being in hospital. And they are now getting in that age group where there's a greater likelihood of needing ICU care. So the pattern is changing as we get into, as I said, as the demographic that's being impacted slowly shifts. And as I said, that is consistent with what other provinces are seeing as well.
Go ahead, Keith, with your follow-up.
And this one's for Premier Houston. Good afternoon. You just issued a news release. Healthcare workers not currently in the workforce are being asked to fill positions in long-term care facilities. I wonder if you could talk a bit about that and why that decision was taken.
Yeah, thank you, Keith. And look, there's a lot of pressure There's a lot of pressure across the system, and we put the call out for people who could help with boosters. We had an overwhelming response, and we had actually heard from a lot of people who said, "Hey, I'll do more when you need it." So this is just a recognition that there's pressure on the system, there's pressure on long-term care. If there's people who can step up and help out, you are welcome. So that's what that's all about, and I have no doubt that many people will step up, because that's what we're really seeing, that spirit we're seeing that blue noser spirit come through loud and clear.
Next, we'll go to Adrian Blanc, Radio Canada. Go ahead, Adrian.
Thank you. Dr. Strang, you mentioned the list that parents have started writing about cases in schools. You warned against a false sense of security for people who don't see their school in the list, but the argument from many parents is that at least they feel they are not being left in the dark and not leaving it to the rumors. So what do you think, clearly, do you think this kind of list can provide some help to parents, or is it dangerous?
So I think the message is certainly if parents want to share that information and about their own status, or the status of the children, or teachers want to do that, they can do that. But we need everybody to act under the common understanding that there will be COVID in schools, but it's also COVID everywhere else. That all of us now have to basically assume that if we're out and about around other people, there's a possibility we've been exposed. We don't need an official notification to tell us that. In fact, relying on the official notification, as I said earlier, can cause that false sense of security. Just assume you might have been exposed if you're out and about in public. And therefore, you need to, every time you go out, closely follow the public health measures around masking, maintaining distancing, all those other factors. Be vaccinated. And if you develop new cold or flu-like symptoms, stay home and follow the testing protocol. That doesn't change whether you've been notified or not. So there really is not a lot of added value in terms of what actions you need to take, whether you have an official notification or not. And it can cause that false sense of security and have people not take the necessary actions they need to do because somehow they feel they're not at risk because they haven't been notified.
Go ahead, Adrian, with your follow-up.
Yes, I believe you mentioned that more test kits will be sent to schools to allow all students and staff to test if they need. So how many rapid test kits are we talking about, and how will they be used in schools?
We're still working out our supply, and then what is the longer then we have to divide that up week by week. So we don't have a specific number, but and the testing is also through schools. Making test kits available through schools is not the only place. We are in the process of we'll have more to say on this in the days ahead as we get now. We talked about last week of having some challenges around supply. The supplies are coming through. And so we're going to be able to then reopen other points of community access, whether it's through primary assessment centers, other community points like libraries in the days ahead for people to get rapid kits. But it still means we still have to focus on those who have symptoms or who have maybe in a place where they have been identified as a close contact. So we're still asking people for the test kits that are available through schools. Is the primary use of those is so people have a test at hand in their home if and when they develop the new cold and flu symptoms and they need a rapid test kits. And the vast majority of students and most teachers are eligible for a rapid test kit to use a rapid test rather than a PCR. But we've also acknowledged that because of some of the concerns and the realities of potential ongoing exposure in schools, that teachers and families can choose to use those rapid test kits for just regular testing once or twice a week. We have to limit it to that amount, and we wouldn't recommend more than twice a week regular testing anyway. But we are working through, and we'll continue to do the best we can to make sure there is some availability of test kits through schools as one of the places, points of access in our comprehensive testing program.
Next, we'll go to Paul Bacon from Nova Scotia. Go ahead, Paul.
Thank you. I'm not sure if my question is for the Premier or Dr. Strang, but we've talked about rapid tests in schools. Will the province continue to provide rapid tests to daycares? We have heard that last week they were told they might not be a priority going forward.
Everything I just said about schools is the same. Daycares are part of that. We will be continuing to provide rapid kits in daycares under the same parameters that I just identified as for schools.
Go ahead, Paul, with your follow-up.
And Premier, I guess Dr. Strang just alluded to this, but at an earlier briefing, you had hoped by the time students went back to school to have more information and update about the large order for rapid tests that the province had placed with the federal government and that was overdue. Is there an update?
Yeah, just look, we keep continuing to get updated information on the arrival of supply. We know that supply is under pressure across the country, around the world. It's amazing the stories I'm hearing about the pressure on the supply chain in general, but certainly around rapid tests. So the federal government has advised us of different chunks of orders that are coming through, and as my message to Nova Scotians is that as we have the supply, we will distribute it to you in the best ways possible. But so it's a moving target, but it is moving, and some supply will start to arrive.
Next, we'll go to Ed Halverson from QCCR Radio. Go ahead, Ed.
Thank you. Dr. Strang, you mentioned that teachers are not required to notify if a student or their parent lets them know that there's a positive test. That's different than the teacher or the principal not being allowed to share that information. I'm not sure if this question is for you, Dr. Strang, or for you, Premier, but why are teachers and principals not allowed to share that information?
Well, in fact, that is misinformation that's been put out there by various groups, that there's somehow a ban or a gag order. That's not true. However, the school system and individual teachers need to be aware that there's legislation that governs how somebody else's personal health information is actually disclosed. It's fine if you as a parent choose to disclose the personal health, your or your child's personal health information. It's fine if a teacher chooses to disclose that. But there's all sorts of issues when people start to get into disclosing other people's health information. And so those are things that the school system needs to take very seriously. We take it extremely seriously in the health system. And I would warn people who are out there potentially using social media, disclosing other people's health information, that they need to be very careful about how they do that.
Go ahead, Ed, with your follow-up.
Yes, thanks, Dr. Strang. And I can appreciate the need for privacy. I do need to, I have to contradict what you're saying there, because I have a letter from a principal in which I can quote the principal saying, "I am also not permitted to communicate with classes or with staff when positive cases occur."
So there has been discussions in the last couple of days with my colleagues in education, and that has been clarified, and that is not actually the appropriate phrasing and language that has been shared with, most recently shared with school administration.
And that's all the time we have for questions. Go ahead, Premier.
Thank you. Thank you for the questions. And we know we're moving forward. We're moving forward through all this together. And I would say we were reminded last weekend, nothing brings Blue Nosers together like a good storm. Whether it's snow blowing a neighbor's driveway or chatting across the yard and gale force winds, we know that we've seen this past weekend. Certainly, I've heard from lots of people that just that connection with other people and the ability to see them and to talk to them. We're all missing that. It's a tough time, and it's our nature to be kind to one another. So what I would say to Nova Scotians is don't let the pandemic change that. public health, your government, your teachers, your people around you, they have your best interest at heart. There's no question about that. So we'll get through this together. We're closer to being through it now than we were yesterday, and tomorrow we'll be even closer again. So stick together. We'll get through this. Have a good afternoon, everyone.